Hi everyone, welcome to my YouTube channel Nikah Med Guide. I hope that you are all doing well. This is my third lecture on basics of anatomy, and this lecture is about abdominal regions and quadrants. This is very important topic for students, not only for theory exam, viva exam, but also for their clinical practice, as healthcare professionals use these regions and quadrants for better diagnosis, surgical plannings, and for many other purposes. So for student, this topic is very important for understanding about abdominal anatomy. Abdominal cavity is largest cavity as it contains many vital organs. So for better understanding about location of different organs, abdominal cavity is divided into 9 regions and 4 quadrants. Before discussing about these regions and quadrants, we should know about how are different organs present in relation to each other in abdominal cavity. So here is an anterior view of abdominal cavity after removing skin, muscles and fat. This is right side, this is left side. Starting from the right side, this is liver. Just towards the back side of liver, gallbladder is present. On the left side, stomach is present. This is esophagus. Just behind the stomach, spleen is present. This is large intestine, and large intestine has many parts as it starts from appendix, then cecum, then comes ascending colon because it goes upward, that's why it is called as ascending colon. This is transverse colon, and this is descending colon as it goes downward. Then there are last parts present of large intestine, that are sigmoid colon, rectum and anus. This is small intestine and it has 3 parts, that are duodenum, jejunum and ileum. This is posterior view of abdominal cavity. This is right side and this is left side. Here is an inferior surface of diaphragm. Diaphragm is a muscle that separates abdominal cavity from thoracic cavity. This is inferior vena cava and this is aorta. Here is vertebral column. This is right kidney and this is left kidney, and on the top of each kidney adrenal glands are present. Here is spleen and this is pancreas. Here starts small intestine and this is first part of small intestine, that is duodenum. This is large intestine and there are many parts of large intestine that I discussed earlier. This is appendix, this is cecum, then comes ascending colon, after that there is transverse colon, then descending colon, then comes sigmoid colon, then finally rectum and anus. This is right ureter and this is left ureter. Before discussing about abdominal quadrants, first we will discuss about abdominal regions. So abdominal cavity is divided into 9 regions by different anatomical planes, and the main objective of this topic is to know about which organs are located in each region of abdominal cavity, and for this purpose we have to see organs in each region from both anterior and posterior view. Two horizontal or transverse planes that are used for making regions are subcostal plane and transtubercle plane. Two vertical or sagittal planes are right and left midclavicular planes. These are anatomical planes and I have already made a lecture video on this topic. So if you don't know about this, you should also watch that video. Here are names enlisted of all regions and we will discuss all these regions one by one. First region is right hypochondric region. This is right hypochondric region. What are the organs located in that region? This region contains right lobe of liver, gallbladder, some portion of ascending and transverse colon. And when we see from posterior view, then upper portion of right kidney with adrenal gland is present in right hypochondric region. Next region is epigastric region. This is epigastric region, and organs that are located in epigastric region are portion of liver, pylorus, and of stomach. A stomach has three parts such as fundus, body, and pylorus. So pylorus portion of stomach is present in epigastric region. There is also some portion of transverse colon in that region, and when we see from posterior view, then portion of pancreas and small intestine are also present in epigastric region. Next region is left hypochondric region, and this region contains stomach, spleen, transverse colon, and some portion of descending colon. And when we see this region from posterior view, then spleen, tail of pancreas, this is tail of pancreas, and upper portion of left kidney with left adrenal gland are present in left hypochondric region. Next region is right lumbar region, that is also called as right flank region. So this is right lumbar region, and it contains some portion of liver as tip of liver, ascending colon, and some parts of small intestine. From posterior view, the main organ in right lumbar region is right kidney. Next region is umbilical region. This is umbilical region, and it contains parts of small intestine such as duodenum, jejunum, and ileum. There is also some portion of transverse colon is present. Some portion of right and left kidney is also present in that region. Next region is left lumbar region, also known as left flank region. So this is left lumbar region, and it contains descending colon, parts of small intestine. From posterior view, the main organ in left lumbar region is left kidney. Right iliac region, that is also known as right inguinal region. This region contains lower end of ileum, that is last portion of small intestine, and some starting portions of large intestine, that are appendix, cecum, and ascending colon. There are reproductive organs of females present in this region, that are right ovary and right fallopian tube. Next region is hypogastric region, that is also known as suprapubic region, because this region is above the pubic bone, that's why it is also known as suprapubic region. So this region contains last portion of small intestine and some portion of descending colon and sigmoid colon. From posterior view, there is bladder present in this region. Hypogastric region contains reproductive organs of both males and females. In females, there are uterus and ovaries present in this region, and in males, prostate gland, vas deferens, and seminal vesicle are present in hypogastric region. Next region is left iliac region, that is also known as left inguinal region. It contains last portion of small intestine, that is ileum, sigmoid colon, and there can be some portion of ureter present in this region, and it also contains reproductive organs of females, that are left ovary and left fallopian tube. Now we are going to discuss about abdominal quadrants. Abdominal cavity is divided into 4 quadrants by one vertical plane, that is median plane, and one horizontal plane, that is transumbilical plane. These quadrants are right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Let's discuss first quadrant, that is right upper quadrant. So what are the organs located in that quadrant? This quadrant contains liver, gallbladder, pylorus end of stomach, this is pylorus end of stomach, ascending colon and transverse colon. And the point where ascending colon turns into transverse colon is called hepatic flexure of colon. As this point is near the liver, that's why it is known as hepatic flexure of colon, and that's why hepatic flexure of colon is also present in right upper quadrant. From posterior view, right kidney with right adrenal gland, first portion of small intestine, that is duodenum, and head of pancreas are present in that quadrant. Pancreas has three parts, that are head, body and tail, and head of pancreas is located in right upper quadrant. Next quadrant is left upper quadrant, and this quadrant contains left lobe of liver, stomach, spleen, transverse colon and some portion of descending colon. And the point where transverse colon turns into descending colon is known as splenic flexure of colon. As this point is near the spleen, that's why it is named as splenic flexure of colon, just like hepatic flexure of colon. And when we see from posterior view, then kidney, left kidney with the left adrenal gland and body and tail of pancreas are present in left upper quadrant. Next quadrant is right lower quadrant, and this quadrant contains small intestine, parts of large intestine, that are appendix, cecum and ascending colon. And when we see from posterior view, then lower end of right kidney, right ureter and some portion of urinary bladder are present in right lower quadrant. Reproductive organs of females like right ovary and right fallopian tube are also present in right lower quadrant. Next quadrant is left lower quadrant, and this quadrant contains small intestine, descending colon and sigmoid colon, that are parts of large intestine. And from posterior view, lower end of left kidney, left ureter and some portion of urinary bladder are present in left lower quadrant. Female reproductive organs like left ovary and left fallopian tube are also present in left lower quadrant. Let's summarize all this lecture. Abdominal cavity is largest cavity and it is divided into 9 regions and 4 quadrants. These regions and quadrants are very useful for studying locations of different organs in abdominal cavity and for clinical practices also. If you found my video helpful, then kindly subscribe, like and share my channel.